Mira. Ang PowerPoint na lang. Okay. Okay na ko. Na. Hello, everyone. We will be starting in 1 minute. Mayang.
There you go.
Hello. In early for today's webinar on caring for older adults in time of COVID-19 pandemic. First and foremost, let's have an audio test to make sure that you can hear us loud and clear. So if you are experiencing any audio problem, kindly write yes, YES in the comment section. Okay, two of our participants cannot hear us. So I hope we can, the tech team can help you so that you can continue listening in this webinar. So I guess we are ready to proceed. So once again, good morning, and it's a pleasure to facilitate today's webinar. I'm May Poblete, a faculty member from the College of Nursing. So welcome, dear students, co-faculty members, staff, friends, ladies and gentlemen, to this morning's webinar on caring for older adults in time of COVID-19 pandemic. So thank you so much for your interest to learn more about caring for your parents, grandparents, relatives, and loved ones, the older adults in particular, in the middle of this pandemic. We are very grateful for Research and Development, Dr. Jinky Bernales, for funding and support of this webinar. Thank you very much, ma'am. So our resource person will be Dr. Precautionary. Is track of the problems facing stakeholders and our part in supporting them. So the main objective of this webinar is for us to better understand the plight of older adults who we considered as the most vulnerable during this pandemic. So allow me to remind you of the following webinar etiquette and some rules to follow while the webinar is ongoing. So make sure that your microphone is turned off or muted while the speaker is having her presentation. I'm also reminding everyone that this webinar is being recorded. Should you wish to keep your camera on, kindly keep movements at minimal. And you may also opt to turn off your camera. So later on, after the presentation, you will be given an opportunity to ask questions to our resource person. So you may do so through directly asking questions by indicating first, of course, your intent to ask question by writing in the comment section or similar to that, like question here, or I would love to ask questions. And then, of course, you have to wait until you are being recognized. So that's the time that you need to turn on your camera and microphone. So please be polite in asking questions. You may also, the second one is that you may also write your questions in the comment section. So at the end of this webinar, we will be having our picture taking for documentation purposes. So this time around, we are requesting everyone to turn on their cameras and of course share your beautiful smile. Lastly, get your evaluation to help us improve for future webinars. So this will be our basis as well for your e-certificate. So link will be posted in the comment section at the end of this seminar. So before I give the screen to our invited speaker, allow me to read a verse from Psalm 36:1 as our gratitude to our Maker for keeping us safe and our families safe during this time. So it reads here, give thanks to the Lord for he is good, his love endures forever. So at this point, I'm honored to introduce to you our speaker. She rose from the rank from being a humble clinical instructor to now the Vice President for Academic Affairs of Cebu Normal University. She is the recipient of the 20th Distinguished Educator in Gerontological Nursing Award given by the National Hartford Center for Gerontological Nursing Excellence in Texas, USA. Help me warmly welcome our resource person, my mentor, Dr. Daisy R. Palompon. Ma'am, the screen is yours.
Thank you very much, May. Allow me to prepare my presentation first. I can't. Can somebody help me with the presentation? I can't share my presentation. Oh, it's here. Okay. Good morning, everyone. Am I clear to everybody? May I have some audio feedback, please?
Yes, ma'am.
Okay, thank you.
Yeah,
Good morning,
yes, very
everyone.
clear.
And I'm I'm very privileged to accept the invitation from the Dean of the College of Nursing, Dr. Mini Mamawag, and of course, the Director for the Research Office of Mindanao State University Iligan Institute of Technology. And I'm very happy to share with you what I've learned and my advocacy is when it comes to caring for older adults, particularly in times of COVID-19 pandemic. Before I will present, I'd like to share with you the statements of the Secretary General of the United Nations, Secretary General Antonio Guterres, which states or who states that no person, young or old, is expendable in times of pandemic. And so therefore, even if we are older adults, even if we are already in the late stage of life, we have the right to continue living. And secondly, that in times of pandemic, physical distancing is crucial. But let us not forget that we are one community and we belong to each other. And lastly, let us not treat older persons as invisible or powerless. Ladies and gentlemen, I'd like to share with you this presentation, but I'd like to also share with you my disclaimer that this is intended for educational purposes only and do not replace independent professional judgment. So any information herein presented are taken from the literature cited under the reference section of this presentation. Our session objectives for this morning's webinar, basically we will address understanding the vulnerabilities of older adults to COVID-19. And that's one of the rationale why we have this webinar focusing on the care of older adults in this pandemic. The second is to determine the risks or challenges to older adults brought about by COVID-19 pandemic so that this particular objective will bring us to the last point, which is to determine suggested ways of self-care for older adults or care provider management for older adults amid COVID-19. Let me just walk you through memory lane, although it was just a few months ago, when we experienced COVID-19, or we call as the SARS-2-CoV. In this particular pandemic, we were caught unaware, and our lives are actually put in uncertain times. And we recall that at the start of this pandemic, sometime December in China and January to March in the Philippines, we were unaware of what this COVID-19 is all about. It was even termed many times with novel coronavirus, and then now we have the COVID-19. And we remembered that when we talk about COVID-19, these are some of the problems manifested by our patients afflicted with this particular illness. So we knew that COVID-19 patients manifested fever, then cough or sore throat, difficulty breathing, and then we have sneezing, muscle pain, new loss of taste or smell. And it was even added for the Philippine manifestations of COVID-19 that there were also cases at which patients experience diarrhea. So these are some of the characteristics or the clinical manifestations presented to us when we talk about COVID-19. And we ask ourselves, who are the people vulnerable to this COVID-19? Let me just walk through currently with what has been presented by the Department of Health based on the June 4 report in the DOH COVID-19 tracker, that currently the Philippines has already 20,000 plus reported cases with only 634 additional for June 4, 2020. The figure is currently increasing, especially since some of the local government units are into rapid testing, and there might be a lot of cases that will be expected in the next few months. However, let us just try to focus on this specific fact when we looked into the 20,382 cases and the number of active cases, the deaths, and the recovered cases according to the Department of Health. Now, if you look into the age and sex distribution as per June 4, 2020 report of the Department of Health, when it comes to confirmed cases, majority of those cases belong to the early adult stage and also with active cases. But the one whose impact was into or was hit hard on this COVID-19 are actually those who belong to the later age, which is around 60 to 79 to 80 years old in terms of the number of death. According to the Center for Disease Control, Dr. Missener, she said that as COVID-19 spreads across the globe, it's becoming more apparent that older adults with underlying health conditions are hit hard. And this is one of the reasons why we have to look into why is it that our older persons are the most hit population and considered as one of the most vulnerable populations that we have when it comes to COVID-19 cases. And it was mentioned in the CDC report that because of their underlying cases, they have chronic existing cases that they have been in existence prior to COVID-19. However, when we talk about the occurrence of death among older adults, let us not also forget, according to Dr. Minachuri of the University of Texas Medical Branch, that when we talk about COVID-19, age and your condition in life will drive your susceptibility to COVID-19 infection. In other words, it's not basically age in itself, that if you are old, you really are going to be very vulnerable to COVID-19. But basically, it has to consider as well our current health condition. And so it shows here that it's not only older adult that has to be considered in COVID-19 susceptibility, but we also have to consider the other factor, which is the presence of existing or pre-existing conditions that we have. So whether we are old, whether we are young, if we have our not so good health condition at this point in time, we have to be very careful because we are considered as susceptible to COVID-19 infection. Now, let me just put more emphasis on why older adults are considered as vulnerable to COVID-19. First, we know by normal physiological processes that as we grow older, by virtue of the wear and tear theory, our immune system also grows older, and so therefore our resistance to infection will also be dwindling as we grow older. Another thing is that if we talk about why older adults, basically we are putting more premium on this factor that we have older adults who have underlying chronic medical conditions. And this is clearly presented in the study of Liu, Chen, Lin, and Han in May 2020, wherein they compared the clinical features of COVID-19 of elderly patients with that of young and middle-aged patients. And their findings showed that elderly patients are severely affected due to their chronic diseases that has been in existence COVID-19. Now, what are these chronic medical conditions? This is not to create a scare to everybody, but it's just a matter of fact that we have to learn so that we also will be aware of what to do if we have these particular conditions. Non-communicable disease pre-existing conditions, according to World Health Organization, which predisposes us to becoming more susceptible to COVID-19, we have hypertension, diabetes, heart disease, heart attack, chronic respiratory conditions, and cancer. So across all ages, if we have these non-communicable diseases, or if you're an older adult with this non-communicable disease as pre-existing conditions, this means that we need more protection, monitoring, and care. And that is basically the rationale why we also have to learn how to take care of older persons in COVID-19 pandemic. Let me just go through you with the daily activities and experiences that probably we have been experiencing for the past months. Probably you have been looking into Facebook or social media reports, and probably you also have seen this in newspapers, electronic copies of newspapers, TV, or heard this in radio, in terms of the daily reporting of the total number of cases of COVID in the Philippines and across the world. We also probably have experienced this one because most of our LGUs are advocating for home quarantine, and most especially that even if you are on GCQ or the general community quarantine, people ages 21 below and senior citizens 60 years old and above, you are not required to go out of your respective homes for purposes of protecting. So there is home quarantine. It says that the senior citizens are already sharing their complaints that they have been placed at home for many months, and they cannot even get their pensions because they don't have anybody to ask to get their pensions or to update some of their databases in their pension so that it will not be cut off. So seniors really are up in arms over quarantine rules. Although there are some beautiful news that is giving of COVID-19 cash aid to all senior citizens, there are also some cases at which there were questions that were raised. If we are given cash aid, am I going as a senior citizen, am I going to go to the barangay hall, or is it going to be delivered at home? These are things that they felt more anxious about because they are also considered as needs of the older persons at this point in time. Plus, we know that older persons are the ones who are very close to the religious practices or their spiritual practices, and most of them are not allowed to go out to attend mass or assemblies in their mosque and other religious activities that they have been doing for many months or for many years actually. So if you're an older citizen or if you're a senior citizen, how are you responding to all these changes in your current life and lifestyle? Probably there are so many mixed emotions that are coming in, so many reactions, so many experiences that can be shared by our senior citizens and for those family members who are taking care of senior citizens at home or distant relatives who are senior citizens with us. And so, ladies and gentlemen, let us try to look into the policy brief of the United Nations on the impact of COVID-19 on older persons. First and foremost, let us try to look into the economic well-being. How does this impact on the economic well-being of our older persons? It may significantly lower older persons' incomes and living standards. As mentioned, these are some of the experiences that our older persons are experiencing. We have neighbors who are senior citizens and have difficulty getting their pensions using their ATMs and other source of ways of getting support from their family members because they are not allowed to go out of their homes. Second, the life and death situation. The fatality rates are telling us that most of those who are susceptible to death are those aged 70 years and above. Vulnerability. The essential care that older persons often rely on is under pressure. Older persons usually have experienced a lot of health problems or health complaints, and in most cases they would like to be brought in the hospital, but at this time it's difficult to bring them to the hospital because we are also afraid as family members to bring them to these areas where we know that cases of COVID-19 are very much increasing. Next is abuse and neglect. We just don't know at-home setting or any other settings, that some of our older persons are telling us that they would like to explore the surroundings, but us or the younger generations of the family are telling them, you stay put at home because you're not allowed to go out. But without due understanding of really the needs of our older persons at this time. Responders, we have our older persons, 60 years old and above, who are still working in hospitals. Like even our government agencies, our department secretaries, our president is continuously working at this time to address the pandemic. And they are considered as older persons. They are beyond 60 years old. And they are part of those who are doing responses. And what about our doctors, our medical technologists, our police officers, our security guards who are already 60 years old and above? They are really vulnerable to COVID-19, but they cannot leave their work because they also need it in the front lines. And the last one, which has all the impact among all the impacts of COVID-19 on older person, I believe, is the mental health. It is said by Secretary General Guterres that we are on physical distancing, but we have to take note that we are supposedly not going to have a social distancing. We have to consider the fact that we are part of one community and that we belong to each other. So how do we address mental health of our older persons, particularly those families or those older persons who are living with siblings who are also older persons, or older persons who are living alone? And how do we address them in terms of their mental health needs? So ladies and gentlemen, I'd like to share with you my framework on the effect of precautionary policies to older adults. We have been addressing a lot of times the pandemic of COVID-19, the precautionary measures that were placed in place in terms of our policies, and we also have our physical distancing. And we didn't probably realize that these particular precautionary measures also have impact to our older persons, and they also have some effect over their physical or psychological or emotional components at this point in time. So we were addressing, in terms of our precautionary policies, we were addressing the vulnerability of older persons to infection. And that's the reason why we asked them to strictly stay at home. But the strict staying at home has to be considered as well, in as much as we also have to look into the restriction of the mobility of older persons. We know that our older persons, especially for those who are 60s and 70s, some of them are quite active and they cannot go out, especially for those who are engaged in senior citizens association, church activities and other religious activities, or they have their own social group to work with before the pandemic came in. So this lead to restricted mobility. And the strict home stay could probably also lead to isolation. You might say, my mama or my lola or my lolo will not experience this because they're living with us. The question would be, you're living together physically, but the question is, have we talked to them on a daily basis? Have we talked to them and asked them, how are they at this point in time? So there's a difference between living together and not maintaining social belongingness within the family or within the household. Another is, when we talk about vulnerability to infection, we say that we ask to put their precautionary measures such as hand washing, wearing of mask, among other things like using alcohol every now and then. What does this create to the person? Even to a young person, to a young adult person, it creates paranoia and anxiety. And it has to be addressed in terms of our older persons because of the fact that they are aware that they are vulnerable to this infection. And they are the ones considered as more vulnerable when it comes to morbidity cases of COVID-19. Another is vulnerability to infection, again, created economic challenges. And these economic challenges has also lead to deprivation. What do we mean by deprivation here? Deprivation in terms of economic uh, opportunities. And we did not realize it that they do not have anymore their maintenance medication. We did not realize it that they're just too shy to tell us as family members that they would like to buy these medications and these things because they are used to having these things. So these are some of the effects of the precautionary measures or policies that we have to older adults. And with these effects of our older adults, the more that we have to provide physical, psychological, and spiritual care to this vulnerable population. Let us try to see what the Center for Disease Control said related to stresses that will go along with the effects of the precautionary measures to our older adults. How does this stress manifest, or how is this manifested during outbreak? So probably these are things that you as a young adult experience, or you as an older adult experience, or you as a member of a family or a family having an older adult who have observed from your older adult family members. So we have fear and worry about one's health and the health of loved ones. How do they manifest this? They usually say things like, how are they? What do you think is happening to them? And when they hear something about increased cases in this particular province, in this particular region, they will always make colleague with you and asking them, can you call them? Can we ask what happened to them? How are they doing now? So these are some of manifestations of fears and worries. Another is, it could also be, instead of sharing verbally these fears and worries, they just kept silent and not saying anything at all. But you will always observe a change in behavior. Then another is change in sleeping or eating patterns. When you are afraid, when you're anxious, when you're worried, in most cases you don't like to sleep. In most cases you don't like to eat. There will be changes in sleeping or eating patterns. So if you are living with an older person, you have to be vigilant about these manifestations of our older persons in the family. Or we have to consider as well ourselves. If you are older adult, how are you sleeping today? How are you eating at this point in time? Are you experiencing lack of appetite? Or you are into binge eating just to relieve the anxiety or the worries that you are feeling? Another is, if you have changes in sleeping pattern, you have difficulty in sleeping, there will be changes in the concentration as well. And this is one of the observations that we have when we did our survey in our university from our faculty members and even our students in the graduate school. And we asked them how are they doing, and most of the reports are telling us that they cannot concentrate in the midst of pandemic. They cannot focus on giving the activities to the students because they themselves are overwhelmed with anxiety and fear. Then we also have worsening of chronic health problems. This is one of the things that we also can observe at this point in time of our older persons. Because at this time, especially if they're aware of what's happening in the environment, they're also conscious of how they are feeling. And they have their existing chronic health problems. Usually this will affect their existing health problems as well. So these are some of the things that we can probably be observing from our older persons in our family, among our family members, or even our neighbors, or even our friends in social media. They share these things with us. And so that would be an alarm for us to really look into what's happening to them at this point in time. According to World Health Organization in 2020, guard the collective wisdom of our societies. And so therefore we need to help our older people during the COVID outbreak. So they are the source of wisdom of our society, and we also have to value them at this time. So we are not only valuing them, but we also hope that they are also personally valuing themselves at this time. So how will I protect myself? If I am an older person, how will I protect myself from all this anxiety, from all these vulnerabilities to COVID-19 infection? I'd say we start first with the physical protection, and that is the most effective means of protection is choosing to stay at home. And you would say, oh, we choose to stay at home, but we are also very at risk of developing social isolation. And these things will be addressed in the next management measures that we can also make use of for our older persons. So the best thing is to choose to stay at home and to use or to practice strict and regular hand washing. Like they say, according to the suggestion of the Department of Health, sing happy birthday until the end, so that and there are some processes that we have to focus or to follow in doing our hand washing. But one of the things that we also have to consider, not only for older adults, but even across all ages, is that when we continuously do our regular hand washing, we also have to check on the level of dryness of our hands, because these are some of the things that we tend to disregard. The dryness of the hands because of constant hand washing. So if possible, we have to minimize if there's really what do you call this, changes in the texture of the skin of your hands, or use lotion to address the dryness. Another is use of physical distancing. This is what I was saying, physical distancing, but not social isolation. You may be 2 meters away from your neighbor who is on the other side of the fence, but you can still continue talking to each other. So you may not see eye to eye, but the fact that you are listening to the voice of another person, that would be adequate enough to address our need for socialization. Then use our etiquette for coughing and sneezing, okay? And then we also have to eat nutritious and balanced meal, and hydrate yourself. But for those who have congestive heart failure or renal failure, you also have to follow what is the required volume of water that has to be taken on a daily basis. Then we have to have sleep and rest, at least 6 to 8 hours, although we know that older persons usually have interrupted sleep. But you can feel, or you can observe yourself or your family member, if they are really getting enough sleep at their own physiological state at this point in time, if at the end of the night or after waking up, they really feel well rested. Then check for signs of anxiety, as mentioned by the Center for Disease Control, and ask for help if needed. There are online telecounseling services, or you may have peers or friends who can do some counseling using cell phones, using social media, just to address the anxiety that is felt by the other person, especially yourself. And drink doctor-prescribed supplements. Please don't forget, if you have antihypertensive medication maintenance, anti-hypoglycemics, please don't forget, it has to continue. The more that we have to be religious in taking in our prescribed medications and other supplements. Then regular disinfection of the surroundings. And when we use chlorine and other disinfectants, please also consider if there are allergies from your older persons and from other family members, because this might cause increase in problems, aggravate some of the allergic reactions of our older persons. At this time, they may not be manifesting cough, but because of the disinfectant that we are using, they are now developing cough due to allergic reactions. And this will really create another problem and paranoia on our end as members of the family. Then, as much as possible, we limit visitors, especially from outside, especially those with respiratory symptoms or travel history. Limit visitors. What about those family members who go out from the house and then come back after doing groceries? It is advised that as much as possible, you take a bath prior to interacting with your older person, or disinfect yourself and those items that you're bringing inside the house. Always, okay, as I have mentioned, always take maintenance medication. and if possible, monitor for any untoward problems or symptoms manifested by our older person. And then if you have quite a big lawn or you have a porch, you can ask the older person to stay in the porch area, but we have to ask them to wear their mask. Now, in the wearing of the mask, please take note as well that if you have worn the mask for this day, do not repeat using the same mask the next day. So it defeats the purpose of wearing the mask. So as much as possible, if you're going to go out, wear the mask that you wore outside should be left outside. And another mask, if you're exhibiting manifestations of respiratory symptoms, then you use another mask inside the house. So do not bring anything from outside to inside, because that will create possible transmission of infectious organism. Furthermore, according to the Department of Health, we avoid touching our mouth, our eyes, and our nose, and avoid chatting in small or congregations outside. We love to be with our neighbors most of the time, early morning, during holidays, or during weekends. We go out and chat with our neighbors. Please refrain from congregating. You can chat through social media or you can chat from a distance, but staying within the area of your homes. Be alert for any flu-like symptoms and consult physician. In most cases, we are afraid to consult when somebody, especially our older person, manifests flu-like symptoms, because we are afraid that people might discriminate you. People might say that this older person has some manifestations of COVID-19. I think that's the wrong perception. If our older person manifests flu-like symptoms, the best action should be to call our doctor or call our physician. Some of our physicians are already doing online consultation. If you have a family physician, call the family physician, so that monitoring and early detection will be done, and prevention will also be provided. Preventive management would also be provided. Like in our case in Cebu City, we have many cases of older adults positive for COVID-19 who have recovered from COVID-19. And the last one, when it comes to protecting yourself, is learn the facts about COVID. If you're fond of reading Facebook, please check if these are not fake news. Learn the basic facts about COVID-19 so that we will not develop our paranoia over what's happening around us. Okay, now I have mentioned about this physical distancing, and let us just try to caution ourselves regarding this. We are, as Filipinos, we are used to socially be engaged with other people. But because of COVID-19, we are expected to do physical distancing. But again, I would like to repeat what I have mentioned a while ago. It's okay to have physical distancing, but social distancing is not something that we have to do, because in socialization, we can still do it even in non-physical process. So how do we address social isolation on the part of the older person when it comes to COVID-19 pandemic? So I got this from the Plymouth City Council and Live Well Southeast organization, how to stay well while at home, especially for older persons. So first is we stay connected. Okay. Talk to your housemates. If you feel that you have not talked to anybody in your household, please do so. Talk to them just with anything that you would like to talk about, just to feel the presence of another person in the family or in the house. Talk to your housemates, talk to your friends, or call a family member or a friend. You can do that through online, you can do that through texting, or calling them through your cell phone, or somebody from the family members can also provide that for them. Watch TV or listen to radio broadcasts, but we have to do this with caution, because again, there are some ways at which information are provided that will create anxiety. So, pwede tayong pursue ng news diet. Ano po tong news diet? News diet means kung magda-diet ka, you have breakfast, tapos lunch, walang lunch, or dinner, meron kang dinner. So, your news diet would be morning lang and nighttime yung news mo. Or you arrange your schedule for listening to the news so that you will not be overwhelmed with some of the negative information that you get from radio or from TV or from the social media. Another is, if you can do it, attend religious events online. Okay, there are. I think there are some masses, there are some mosque assemblies that are being done online, and you can be part of that one so that you will not feel disconnected from your spiritual activities. Or engage in social media activities. So dapat, if you don't know FB now or Twitter or other social media platform, you have to tutor yourself, or you have to ask a family member to teach you to do that. Or other family members, please be there for your older persons so that they will also have connections. Now is the time probably to renew our social engagement with those classmates of ours who retired already and probably are into social media. So this is one way of staying connected. And then look out of your window. Very simple. Just to be connected with other people, look out of your window, wave, smile, or say hello to anyone who passes by. Okay, so that is one way of staying connected. So you are physically distancing, but you are socially connected to others. The second would be explore and learn. So with all the times that we have at home, we can do exploration and learning. One of which is, if you're fond of reading book, it is now time for you to read a book, a new book, or some books which you probably have stacked up in your library or in your corner, or reread some of the beautiful books or notes that you've had before. Create your own coffee table book if you have some wisdom or experiences that you would like to share to others. Learn social media. If you are, there are free subscription to iWant, to Pinoy Tambayan, to Netflix, just to be able for you to explore what's happening in the world, the movies that you have neglected before because you were very busy. So this is now the time for you to explore and learn about these things. Learn new word every day. Okay. I'd like to say that today my learning would be nobody is expendable. I'd like to be re-educated on the fact that nobody is expendable in times of pandemic. So these are some of the new words, the new terms that you can learn every day. Discover what are your interests. I have a friend whose interest was basically, she knows how to cook. She knows how to bake. But currently, she's discovering new things. She can go into business when it comes to baking. So she has a new home setting business now. So discover your interest. Like if you want to explore further on some skills that you can do at home, or enroll in free online classes. And I'm happy to share with you that some of our colleagues in our university, we finished our online classes with UPOU. Hopefully we earned the certificates, and we are looking forward to these things. So you can do online classes, just very simple webinar classes, and then you get certificates out of it. Then stay active, do things that you enjoy. So how do we stay active? So walk in place within the house, okay? Don't just sit down. You stand up, you walk around the house, you do simple stretching, and don't allow yourself to just lie down. If the Lola or the Lolo is already bedridden, it's high time for us to help them do some isometric exercises, because some of the family members are available to do it for them. Okay, then find better ways of engaging in physical activities like doing light chores. If you have your small gardens in your front yard or backyard, you do some gardening, and then join Zumba Gold through online media. We can also do our um, geriatric TikTok sessions. So these are some of the things that we can do. Enjoy doing it. Okay. Like what I usually do at home, I ask my younger son to play the vinyl, and then we do some old 45 music, and we dance and just do some rhythm together, just to be active all throughout the day. Then we take notice, do things you enjoy, like listening to music or doing artwork, or do some clear the clutter day. If you can see in the Facebook, there are many of those friends of mine who are posting our old pictures when we were still elementary or high school or even in college days. And some of my co-faculty members are posting our pictures way back when we were still new in the university, when our waist are still 21 or 22, which nowadays, never mind what's happening with our waist. So these are some of the clear the clutter day that we can do at home. Then you can do reflective moments like yoga or doing reminiscing. Now, what about if our older person is bedridden? We can do some reminiscing activities with our lolo or our lola while on bed. Like, for example, ask them, like, for example, Lola, do you still remember when Lolo courted you? Or can you share with me what was your love story? And those things, reminiscing, because really reminiscing is something that makes the older person feel that they are still relevant, and that they feel that they are still alive at this time. And word games like Sudoku, among others. So there are many word games that are available that we can do at home setting. And the last one would be sharing. Okay, so they say that if we share, we feel good. Okay, I don't know if you are familiar with the trending now in the Twitter and in Facebook. The 82 years old Lolo in Manila, who has been, every time that he goes home, he passes by a store of bicycles. And then every time that he passed by, going to his area, he's selling candies, man. He always asks, how much is this bicycle? And then when he goes home, again, he asked the sales girl or whoever is there, how much is this bicycle? And every day he keeps doing it until such time that the one person that he was able to ask was the owner, who is also an older lady. And then the personnel of that store probably have observed that this Lolo has been asking every day, going in, going out. He keeps on asking, how much is this bicycle? And he keeps offering, is it okay to buy it at 2,000 pesos? And then 2 or 3 days ago, I think this is just a week, within the week, he asked again the owner, and the owner said and he said, can I buy it for 2,000 pesos? And the owner said, okay, you can get it for 2,000. And then the owners asked for a receipt. But actually, when the receipt was given, it's not the receipt that was given back, but it's the 2,000. And the older person was just interviewed now in Twitter, and she shared that it really feels good to share to other people. So even if we are older adults, even if we are homebound, we can do sharing so that we will also feel good. So sharing could be done not only through sharing of physical items, but call a friend whom you have not talked with. So sharing your time with others, share what we have to others, like the one about the bicycle, and also what is very trending now is the bargain. What do you call this? The barter change that is happening in Cebu and in other parts of the country. Instead of barter change, what the other person usually is giving in exchange is nothing, and they were told, just do your best with your studies. So sharing what you have to others can make you feel good, and it makes more positive, your feelings more positive. And then volunteer to do tasks at home. So if you're an older person, you can volunteer some very, very simple tasks at home. And as members of the family, don't deprive them from helping us out. You just give them simple activities. that will not be too risky for them. So put a chair near the table for them to probably cut some of the beans. These are some of the simple things that our older persons can volunteer to do at home. Okay, and the last one would be probably donate. If you have some things to share, you can donate in cash or in kind. So that will make you feel good, and that will really make you feel relevant at this point in time, that you belong. And even if you're an older person, you can still be of help to others. What about for family members of older adults? That one, the first steps that I shared with you was basically for both the older person and for those who are family members. But this is just specifically that I'm sharing with you for family members of older adults. Let us not forget to respect older people. Remember, nobody is expendable and everybody has the right. So we respect older people. Let's examine ourselves and reflect. How do we usually answer our older person in the family? Did we answer them respectfully? Did we consider their needs? Did we consider their suggestions? Or we just disregard them and tell them you're old enough, you don't have anything to do with us anymore, or some things. So respect older persons, especially at this point in time, wherein they are very prone to abuse. Abuse does not come only with physical abuse, but also with verbal abuse. Talk to your older family members. If you are not from home, call them regularly, be updated with them, just listen to them, because they probably are in need of somebody to listen to them. Monitor how they feel. It's very important to ask them, how do you feel now? Do you feel anything painful? Do you feel afraid? Or do you want something to do? Or would you like me to assist you? So these are things that we can do for our older person. Follow all precautionary measures. If you are the non-older person in the family and you are the ones going out to do errands, follow all precautionary measures, because anything that comes in from outside can be a source of infection to our older person. Disinfect items from outside and provide management for physical concerns. So if our older person says, I don't feel good, please don't disregard what they are feeling, because that might be something that is really actually a problem that needs to be addressed as soon as possible. What about for those who have neighbors who are older persons? We probably have other older persons in other houses near us or within our blocks. Check in on them regularly through phone calls or just calling them outside the home. How are you? How are you doing there? Or send them a message that they are, you're thinking of them, that you are there for them, that you can assist them anytime that you want them to assist them. Leave a note on their front door. Just let them know someone is thinking about them. So like, it's our culture to share food to others. So you can just leave the food. Usually our practice here in our neighbor is we place chairs outside when somebody says, oh, I'm going to send vegetables or food to you. So we place chairs outside our houses and we place our goods there, and then somebody will take it from the other house. So these are some of the things that we can do for our neighbors who are older person. Cook something for them and leave it outside their home so that they will also feel that they are really supported by others, especially for those older persons who are alone at home or who have nobody at home with them. Okay, and then you can do errands for them. You can volunteer to buy them their daily essentials like milk, bread, eggs, vegetables, or anything that they would like you to be brought. So every grocery time, make it as a habit, if you're the ones going out to do grocery, to ask, you have anything to buy outside so I can bring it with you or I can buy it for you? You do the errands to the grocery shop, ensure their medical supplies are stocked up, and then send them a little reminder, asking them if they are still taking their medication. So just some little things, simple things that we can do for our neighbors who are older persons. So, ladies and gentlemen, as I close this presentation, I always advocate this statement from Pope Francis, who states that a population that does not take care of the elderly and of children and the young has no future because it abuses both its memory and its promise. So thank you very much, and I hope that you get something out of this presentation. Good morning, everyone.
Thank you so much. And we learned a lot. Okay, now it's already 10:58, but I would like to extend our webinar to accommodate some of your questions. If you have some questions, kindly indicate in the comment section to ask questions to our speaker. So, hello, ma'am. So while they are composing their questions, so let
May, I think there's a question on the chat room that was presented by Dean Mamawag. May I answer that one?
okay, ma'am. Hello, please.
Yeah. Yes. If there
Yes.
are cases in which there are
Cases in
conflicts within family, and, and they couldn't manage their elderly, what can you suggest? These are some of the unique
can you
cases,
suggest,
but
ma'am?
common among Filipino family members, wherein there are conflicts with their family members or their older person in the family members. Now, the best thing that we can do as of this time is there are times that we don't understand our older person. They have different perspectives, and they have their own philosophies in life which we cannot understand, particularly when it comes to generation gap. But however, the best person who should address this conflict would be the younger members of the family. It's just a matter of um, developing a sense of understanding and a sense of concern for the other person. If there are times that usually some of our older persons are a little bit cranky as they grow older, it says that something negative should not be responded with another negative. If the older person is already cranky and there are some conflicts within the family, the other person or the other party should be humble enough to address this concern or to give positive response rather than the negative. Now we have cases at which older persons tend to are very irritable, and you want them what do you call this? You want them to do something, but they don't accept or consider what you're suggesting because they feel that they are more in authority than you. So the best thing for us to do is never to retaliate. Okay, never to retaliate, and find ways at which you can look for a window where you can get the trust of the other person or the older person. And this also is part of my theory in caring for older persons, that in most cases when older persons tend to be cranky or have the tendency to be irritable, at first time they are showing you lack of trust at that point in time. So what do you need? A window. What is that window for? The window is the one that will allow you to get into the other person. And how do you do that? Be always there. Be always there and be consistent with the other person. So even if your lolo or your lola keeps on scolding you every time that you say, "How are you today?" And you will be told, "Never mind me, I don't care about you." Every day you can do it, like say good morning, just say something positive to the other person. And you will notice that as you grow along, as you move along, and they will feel your absence, they will really look for you. So it's a matter of tiyaga, it's a matter of patience when you are going to deal with this older person. And try also looking for a subject wherein neutral for the other person. Like I have mentioned about talking about their love story, talking about their accomplishments before. But when you allow them to discuss these things to you, please do not also try to what do you call this? Question them of what they're sharing with you. Allow this information to flow, allow the sharing of experiences to flow. As you go along, they will feel good about themselves, and the consistency of what you're doing will usually be considered by the older person as something that is positive. And so it's again, it does not happen overnight, but this is based on the theory that I have developed in caring for older persons. So not at the time that you are going to approach and immediately that person will really listen to you or allow you to be part of her personal or his personal circle or his personal space, or accept you in his or her intimate space as a person. It takes a lot of patience and consistency, actually. So if there are some conflicts within the family, the best person to address that are the ones who are in the younger generation. Or depende sa if the older person has a very good perspectives, good if the mental perspectives are still intact. But if the older person is demented, you cannot expect anything from a demented person. So what you are going to do is the other person who is taking care of the older person, the other family members, should maintain consistency and patience in dealing with the older person. Sometimes you probably will be rejected. In most cases, that's the initial step, that's the initial experience that our care providers experience. But as you go along and kumbaga nakuha mo yung kiliti ni lola or ni lolo, you will realize later that they will be looking for you when you are not there at the time that you're supposed to say good morning or good afternoon to him or to her. So these are some of the strategies that we can make use in dealing with our older person. So I hope I answered you, Din Mini.
That always be consistent. And then, ma'am, if Sambo, if you have, she's asking what's your suggestion if ever some of our elderly loved ones sneak out without our knowledge just because they feel that they are imprisoned in the house and would like to do some shopping.
Yeah, true. This is one of our challenges, no, because especially for those older person who are still able physically, and they can still drive, they can still ride the motorcycle, they can still walk distant areas. So these are some of the things that usually are um, given as challenges to us family members. So probably the best thing for us to do is to do some contract negotiation. Kumbaga, there's a negotiation point between the family members and the older person. Usually they sneak because they feel that they're not allowed to share what they want to do or to do what they want to do. So the best thing for us to do is do some negotiation and some agreement with, like for example, you say, Tatay, if you really want to go out, you tell me, and we will schedule, and then we will find areas where you will be prevented from going into group. So if and then you have to make do with your promise. So if we say this coming Saturday, I really would like to go, and where would you like to go? To the beach. Okay, so we will go to the beach, but you will not go out of the car, or we will go to the beach, but you will just stay. Do not we don't what do you call this? We don't swim, but we just go out just to see what's happening around the world. Why di naman you can do some touring around your place, but just be sure that precautionary measures are there. They are on mask, and do not allow other people to get near them except the family members whom you know and you're very what do you call this? You're aware of their physical conditions, and schedule lang. You do some scheduling, and then try to and fulfill what you have discussed with your older person. Like, oh, if they want to go shopping, so check first the area. So it's a matter of management on us family members. Let's go to an area in the shopping mall where there are no people around, or if you want, but if it's really strict in your area that older persons are not allowed to go out and they don't have any pass, for the GCQ pass or other permits that they will be allowed to go out, you just discuss with them and say, is it okay if we go somewhere and then we just tour around Gaisano, or we just tour around Robinson, so that you will see what's happening. And then whatever it is that you want to buy, somebody will do it for you inside, and you will just stay here. If you have some messenger, you can call and then say, do you like this lolo, or do you like this tatay? So these are some of the things that we can do. Kumbaga, these are things that we need to be very creative, so that our older persons will not also feel that they are deprived. So to avoid them from sneaking out or from not telling us, then the best thing that we can do is talk to them and arrange the schedule with them. So and let them know and let them understand that you are doing everything to arrange the going out or the outing, para the person will not also be not feel any deprivation at all socially.
Thank you, Doc.
So
We will
a
accommodate.
matter of arrangement.
Okay, yes, Doc. We also have another one from Kyle Jeremy Soquano. Is there a certain time wherein the use of face masks may be excessive or harmful to our grandparents? What what is your or what are your recommendations, ma'am?
Okay. Now, the precautionary measure says that if you feel that you have respiratory infection or you're manifesting flu-like symptoms within the house, you wear your mask because you want to protect others. So if you have a lolo or a lola at home, but they don't manifest any flu-like symptoms within the house, they may not wear the mask. When they go out, like doing gardening, they can wear the mask, but see to it that the mask is not impeding their much of their breathing. And when they do the gardening, for example, depending on the physical activities that they're doing, see to it that they are still able to breathe. You're not using the N95 mask because the N95 mask definitely will obscure some of our respiratory airway filters because these are quite more kumbaga thicker in terms of manufacturing preparation compared to the usual cloth mask or surgical mask. So you check the mask and see to it that it's not too thick and it allows still normal breathing to take place. Now, it will be what do you call this? It will not be good for the older persons to wear mask at all times at home because you're impeding their normal breathing airway. So you wear a mask if there's a need to do. So for example, if you bring lolo outside, if the lolos and lolas are allowed to go out in your place and you want to go to an area for them to just see around, if they're in the what do you call this in the car, they may not wear the mask. But if you open the shield or the windshield, or if they're going out, they have to wear their mask. So it's a matter of looking into the situation when the mask should be worn and when it should not be worn.
Mm-mm.
I hope
Yes.
that answers the question.
Okay. We will accommodate three more questions. Ma'am Days, how are we going to deal with our older adults with mental health issues?
Okay. Um, That's the I'm my question would be older adults with mental health issues staying with a family or do not have family. So I'll focus more on older adults with mental health issues with family. Basically, this is really a trying time for these family members who have adults who have mental problems, particularly for those who have dementia, schizophrenia, and other even not only older adults but also young ones who are having autism. So the most literatures will tell us that the family members or the caregivers have to be creative enough to provide the routine activities that they have been doing in such a way that they will be able to gradually shift from the usual thing that they're doing to the new things, the new normal that we are doing at this point in time. So for those who have older persons who have mental problems, check if they are on complete medication
Mm-mm.
because you will have difficulty controlling behaviors if they are not very religious when it comes to their medications, if they are on medications. And for those older persons, for those family members, we have, again, as I've mentioned, be creative with the activities.
Mm-mm.
Some of them will probably, again, will sneak out because they want to go out. Um, that's one of the things that we don't what do you call this, these are things that probably will really happen because some of these older persons really would like to go out and be free. So the best thing that we can do is if we can, I'll ask them to wear their mask if you cannot control their behavior, and then as much as possible, good if your subdivision or your area is really has a checkpoint so that you can discuss these things with those manning the checkpoint that do not allow this older person to go out. So we have also cases like this in our neighbors, and the thing that we ask for our security guard in the subdivision is that allow her to go to room, but have to wear the mask, but do not allow her to go out of the gate. So she goes out because we cannot control her. She's the only one at home. So she goes out, but when she arrives at the gate, the security guard will tell her, no, you cannot go out and you have to go home. So she goes home again. So these are things that we did. Because we cannot control some of them. So good if your house is really that very big, that you can allow them to go anywhere and build your own playground or areas where where you can create your picnic area. Good if you have those types of places, because you can recreate some picnic area, doing your breakfast outside or having your dinner outside over a fire or something. So these are things that we can do creatively for our older persons. So, but please, if they have mental disorientation, as much as possible, medicate them, and then at the same time, prevent as much as possible physical abuse from taking place in those patients. Now, if if you're unable to really control, then you have to call your physicians so that you will be advised whether the patient has to be placed in facility or has to be placed at home setting lang, and then do some and have some medications to control the behaviors.
Yes. Thank you, Doc. How about working older adults, Doc, especially those managers? How will you advise them that it is good for them to work from home because they are prone to this pandemic? So this is a question from Joan Tabada Renido. What's your advice for
Okay,
older adults?
that was, yeah. I think that's a very good, that's a very relevant concern that we have to raise at this time. And for medical practitioners, nurses, and medtechs, some of our doctors who are already senior citizens are still continuing to volunteer to work in the medical setting. Like our nurses are also doing their work, but there are some hospitals wherein they place some precautionary measures, like if their personnel are older persons, they place them on office work, or do activities that has reduced contact with patients. Now, what about for other organizations? Like, for example, for schools like us in state universities and colleges, and we have our managers, and even we have our faculty members who are also senior citizens, and we probably are preparing not only for this month, but even during the opening of classes, that they probably will be affected with this GCQ. So, and they will not be allowed to go and report for work. So if the work can be done at home, then we advise them to work from home, because it's also stipulated in the civil service circular that for GCQ, some of our senior citizens might stay at home and adopt the work from home alternative work assignment. For our case, what we do is, if you are already a top management senior citizen, you're asked to report, but on limited number of times in a week. So one or 2 days per week for senior citizens. But for our case, for our teachers, when we start our classes by September, we already have our alternative, that if in case we have the second wave in the GCQ will be changed to ECQ or some other uncertainties that might happen by then, we already have our alternative, that our senior citizen faculty members will have the work from home, but they will be preparing for their modules, for sharing for the students, and they will also be training for the online teaching learning modes. And in cases wherein there are some students who would require face-to-face interaction because they are just living near the university, then we call that as our surrogate faculty member, an avatar of the senior citizen who is a junior faculty will take charge of the face-to-face classes and will provide for the modules and other instructions. But the one who will be taking care of the monitoring and evaluation and assessment of the learning of the students assigned to that class is the assigned senior faculty member. So at this point in time, we really have to confer as well, or to conform as well, with the work from home assignment for our senior citizens, especially if our type of work is really increasing in terms of we will be predisposing or increasing susceptibility of our senior faculty members or senior workers to the transmission of COVID-19. So these are some of the things that are being done. Some companies are also doing strict work from home for those who are older members of their companies, even especially older adults with underlying conditions. So they are only asked to report once a week, or they do full work from home the whole week. So these are things that we really have to look into as part of the management COVID precautions.
Okay. Thank you so much, Doc Daisy, for your advice and insight regarding working. I have one last question for you naman, guys, on how they can lessen the use of social media, especially Facebook, among older adults, wherein they can get fake news because there are so many fake news circulating nowadays.
Okay.
So given most of their time.
Yeah. Okay. That's also one of the drawbacks of social media, because there are fake news that needs to be filtered. Although if you are friends with your older persons, you can create there's a filter that you can adjust, that those who have sensitive issues, or those sensitive issues should not be shown to the Facebook page of that account, of the owner of that particular account. Or else, the best thing that we can do is, yeah, I also experienced that one with some of our older persons who are friends of the family, and sharing this in our group chat, some fake news about COVID, that there are some people who are dying because of this and that. So the best thing that we can do is talk it out with this with the lolo or the lola. So like, for example, there is a fake news, and then usually they start sharing it with us. So when they share it with you, you have to give the facts related to that particular information, and you need to explain it to them in a matter of fact way. So there are some cases that in the fake news that you need to drink this, and then you need to have this some amulets for COVID-19, and some of these beliefs and practices for COVID-19 to be prevented and for treatment. So it's a matter of communicating it to them and explaining it to them, so that they will also be guided on what news to believe in and what not to believe in. So even telling them or discussing it with them some of the sources of information which should not be considered as true at all times. So you can also discuss it with them, so that they will not, usually the cause why they are noisy about these things, they keep on talking about these things, and they usually share with you, this is really the truth, and these are the things that we should do. Sometimes that's because of their anxiety manifesting. So you need to understand what they are feeling as well, so that you can talk to them in a calm and matter of fact voice. So don't also argue with them, because arguing can never lead to something good. When you argue with an older person, You will not really come emerge as winner out of that. You will just end up hurting each other. So just talk and continue discussing things with them so that they will be guided na no, that is not a correct thing, so that is not true. So that if we can find some ways in tracing sources of information so that they will also be guided in doing this. So I think those are things that we need to consider. So open line of communication is really very important for our older persons, and do not just disregard them. Do not also take for granted what they're saying. Again, when you care for older persons, it's really a matter of patience, understanding, and most of all, love for older person. That will really be the best instruments that you will have so that you will be able to deal with these types of, with our vulnerable population.
So much, Dr. Daisy. So that ends our open forum. So get ready with your camera because we will be having our picture taking. So while you are preparing, allow me to read the inscription of the certificate of appreciation to our resource person, Extension, University So for the webinar Caring for Older Adults in Time of COVID-19 pandemic, signed Dr. Jinky Bernales, the Vice Research and Extension, Dr. Sitang University Iligan Institute of at having our picture taking. So I'm requesting everyone patient purpose. Okay, are we all ready? So one, okay, another. So thank you everyone time to be in this webinar. Thank you very much to our resource person. So before we end, don't forget to the evaluation for giving us advices and insights regarding the taking care of our continue to shower our older adults with our love, patience, and also our devotion to them. I'm May Poblete, saying good afternoon, everyone, and stay safe always.
Thank you. Thank you very much.
Thank you, Doc.
After
Thank you. May nasa evaluation.
ano to, ano sa comment?
Butang
I-send
balik
po sa email. Wala?
Wala naman sa taas.
Huwag na. Bongga sila, please. Pwede na dito makinaw hanggang please nilo. Oo, hindi na mamatanya. Maginaw na kasi lahat.
Remember kung may ganap ang class, diba?
Alam mo, yata ka ang busy.
Sabak kay ka.
Ay, sorry. Ay, siya ako, ano? Oh, yeah.
Punta yung